So let's start with diabetes type 1. In diabetes type 1, you get a destruction of pancreatic islets of Langerhans and inadequate or no production of insulin, and that would lead to the increased levels of glucose and all that follows. So let's talk a little about that. So you know that in your pancreas, you have islets of Langerhans, which produce insulin and glucagon. So let's zoom on those. Okay. So you know that your islets of Langerhans are islands of endocrine tissue embedded inside your pancreas, and these islands have some sort of internal structure to them. What I mean is that some cells specialize in producing insulin, some cells specialize in producing glucagon. So in the middle of the islet of Langerhans, you would have the alpha cells, and alpha cells will be producing glucagon. And on the periphery of the Langerhans islands, you would have beta cells, which would be producing insulin. Okay, and so what happens in diabetes mellitus type 1 is that there's some deficient in the self-tolerance of your own cells. In other words, your immune system will mistaken either your alpha cells or beta cells or both for some foreign cell, some foreign substance, and will start to attack it. Okay, and so the initial strike comes from the T cells, which are responsible for the cellular immunity. However, as it starts to kill off these beta cells, the insides of the beta cells are exposed to the immune system, and then your humoral immunity will start to react to these products as well. And it will sort of aid in destruction of those islands. Yeah, and now that you destroyed the islets of Langerhans, there's nothing to produce insulin, and so your blood levels of glucose will go up. Now, you might have a question that if I destroyed beta cells along with alpha cells, how comes that the blood level goes up, right? Because, yeah, I lost the insulin, which would decrease the blood levels of glucose, but I also lost the glucagon, which would increase the blood levels of glucose. However, insulin is a way more powerful hormone, and it can easily overpower the effects of glucagon. So even though in diabetes mellitus type 1, you lose the ability to produce both insulin and glucagon, the effects of losing insulin are way more severe. So what happens? You lose the ability to produce insulin. Without any insulin in your blood levels of glucose increase. And this increase in blood glucose, also called hyperglycemia, will lead to the symptoms of the diabetes mellitus type 1. Okay, and the increase in glycemia will give you the symptoms of diabetes mellitus type 1, and the symptoms are as follows: weight loss, polyphagia, polyuria, polydipsia, and glycosuria. Okay, and now let's cover these one by one. So weight loss, why does the weight loss occur? Now, insulin has actually anabolic effects. Sort of makes sense because if you remember, the insulin takes the glucose and puts it inside a cell. If the cells do not have the glucose, there's nothing to build new stuff from. And so the people with diabetes mellitus type 1 start to fast. At the beginning, the weight loss is more insidious. However, as the disease progresses its later stages and people have almost no insulin or no insulin left at all, the weight loss will be more pronounced. So the weight loss because of inability of the body to utilize glucose properly. Then polyphagia, that's increased hunger or increased eating. Okay. And why people eat? Look, in diabetes mellitus type 1, the cells are starving for energy. And so they send these signals, hormonal signals, to the hypothalamus that will trigger their hunger. And so people start to eat more. Also, what happens, and this is related to the glycosuria, glycosuria is presence of glucose in the urine. Normally in urine there should be no glucose. However, as the glycemia increases, the amounts of glucose that enter the kidney is too high for the kidney to filter and reabsorb from the proximal tubules back into the blood. And so the leftover glucose will make it all the way to the final urine, and people will pee the glucose out, right? And now if you think about it, you are peeing out the energy, right? The glucose is something that you ate, and your body now cannot utilize it, and you're losing it in the urine, right? And so you have to make up for that lost energy by eating some more, right? So polyphagia, because your cells cannot utilize the glucose, and because you are losing the glucose, aka energy, in the pee. Now, the glucose in the urine actually has osmotic effects, so it will drag the water itself, and so people will go to the bathroom more often because they would have to pee. This is called polyuria. Polyuria, increased frequency of peeing. And because they pee out lots of water, they also need to drink more. Okay, and now how would you treat the diabetes mellitus type 1? Because the major problem is that the body is starved of insulin, the easiest solution to this is to inject the people with insulin. Also, this is autoimmune disorder, and it affects young people, especially adolescents and pre-adolescents. So let's say from 7 till 12, 13 years of age is the biggest peak. However, some forms of diabetes mellitus type 1 or some forms of diabetes which is caused by low amounts of insulin, they can occur also in adulthood. However, typical diabetes mellitus type 1 presents in children. Symptoms: weight loss, polyphagia, polyuria, polydipsia, glycosuria, and is treated by insulin injections. Also, you should maybe know the name of the most severe complication of diabetes mellitus type 2, type 1, and this is diabetic ketoacidosis. And for entrance exams, you don't really need to know much more. Just know that diabetic ketoacidosis is associated with diabetes mellitus type 1. Basically, what happens is that because the cells are starved of glucose, the body will try and produce some ketone bodies instead, because it will think that the body is starving. However, you might know that the ketone bodies decrease the pH of the blood, and that can lead to acidosis, acidic blood, and this can lead to some serious, let's say, complications and metabolic disbalance, and eventually coma and death. And this would be diabetic ketoacidosis. Okay, and so these are the basics about diabetes mellitus type 1. Okay, so now on to the diabetes mellitus type 2. So just to review what happens. So insulin binds to its insulin receptor. This will trigger, or this should eventually trigger the incorporation of the GLUT channels inside the membrane by merging of the vesicles with the cellular membrane. So eventually, you get something like this. Right, and through these GLUT channels that are now incorporated inside the membrane, the glucose could enter the cell. However, what happens in diabetes mellitus type 2 is that the insulin receptors do not react properly to the binding of the insulin. So you get something called insulin resistance. That means that this step between the binding of the insulin receptor and incorporating of the GLUT4 channels, this will not occur. That means no GLUT4 channels will be on the membrane, and no glucose can enter the cell. And so the levels of glucose will increase outside of the cell, that means in the blood, but there will be very little to no amounts of glucose inside the cell. And again, this is what's going to give you the symptoms. Now, because these cells are starved for insulin and the insulin is still being produced, what actually is going to happen, the insulin levels initially, at the initial stages of disease, will go up. So initially, the insulin resistance or the insensitivity of the insulin receptors to the insulin can be somewhat overcome by the increase in insulin. However, this lasts only for some time, and eventually, despite the increased levels of insulin in the blood, the glycemia will increase. And as the blood levels of sugar increase, you get all your symptoms. Now, in diabetes mellitus type 2, these processes happen actually over years, maybe even decades. And it's not a matter of weeks or months, like in diabetes mellitus type 1. And so the symptoms will be somewhat different. Yes, people can have polydipsia, polyuria, etc. However, this is not very typical because instead they get the long-term complications of diabetes mellitus type 2, which are derived from the protein glycation or glycosylation and from the osmotic damage done by glucose. Okay, and so what I mean by protein glycosylation, let's say you have some protein randomly somewhere in your body and it does its thing, right? It might be some structural protein, it might be some enzyme, however it's working like it should. But if you have high levels of glucose in the vicinity, the glucose can actually force itself onto the protein, the enzyme. And this is the glycosylation or glycation proteins. Basically, those proteins will be enriched, so to speak, by the glucose. Okay. Now, you might imagine that if you have all these glucose molecules on the surface of the protein, this could interfere with its function. And it actually will. And most notably, what this will lead to is something called angiopathy. Right? So in your blood vessels, you have proteins inside the wall, inside and also outside of the blood vessels, and they create lining, right, and help the blood vessels to function properly. Now, if these proteins are glycosylated, their function will change, and what this might eventually lead to is angiopathy, or more specifically and importantly, atherosclerosis. These glycosylated proteins will allow the LDL molecules to go underneath the intimate layers and it will start to deposit there. And you will have your atheromatous plaque that eventually might protrude inside the blood vessel and create some stenosis or maybe rupture, etc. So that's the protein glycosylation. Okay, now onto the osmotic damage. Places where osmotic damage occurs in diabetes mellitus is maybe the lens in your eye. Okay, and so what happens during the diabetes mellitus is that the metabolite of glucose called sorbitol might get accumulated inside the lens. And these sorbitol crystals will join water, and the increased concentration of water will actually change the properties of the lens, which will lead to cataracts. You need your lens to be clear. If sorbitol accumulates, it becomes less clear and you can't see through. This is what cataract is, pretty much. Okay, so protein glycosylation, osmotic damage, they lead to angiopathy, cataracts, neuropathy, retinopathy, and many others. Okay, now we might ask how this will be treated, because it doesn't make sense really to treat this with insulin, because in diabetes mellitus type 2, you have actually abundance of insulin inside the blood, but insulin does not do anything, really. And so the only way to do something about it is to offset the insulin resistance. Now, there are many ways how to do it or trying to do it. The first and least the invasive way would be diet. It turns out that the insulin resistance is related to, let's say, bodily habitus. What I mean is that people who are overweight or who are on certain types of diet, they are more prone to get diabetes mellitus type 2. And if they were to change the diet, the insulin resistance would drop, and also they might get rid of the diabetes completely. However, if the diet does not work or the person is incapable to go on a efficient diet, the diabetes mellitus type 2 can be treated semi-successfully by some perioral anti-diabetic drugs. So abbreviated PA. Basically, they take pills, and the pills will influence the ability of insulin to push the glucose inside the cells. Okay, so this is what happens in diabetes mellitus type 2. Diabetes mellitus type 2 is actually a disease of elderly, usually. It is tightly related with lifestyle. So people with, let's say, obesity or weightness, what's considered unhealthy diet, etc. Those are the people who get diabetes mellitus type 2. There is also some genetic predisposition for sure, just like in diabetes mellitus type 2. However, there is rarely some autoimmune disorder underlying this cause. This seems to be purely metabolic. And yeah, so this is it. This should cover vast majority, if not all, of what you need to know about diabetes mellitus type 2.